Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Quick Disabilities of the Arm, Shoulder, and Hand questionnaire assesses physical function and symptoms in patients with upper limb musculoskeletal disorders. Its main purpose is to measure the severity of disability and monitor changes over time in conditions such as tendinitis, carpal tunnel syndrome, and fractures. The tool evaluates the ability to perform daily activities involving the upper extremities, including lifting, gripping, and fine motor tasks. It also captures pain intensity and the impact of symptoms on social and work-related activities. The Quick Disabilities of the Arm, Shoulder, and Hand provides a reliable and valid patient-reported outcome measure for clinical assessment and research. The Quick Disabilities of the Arm, Shoulder, and Hand questionnaire is indicated for patients experiencing upper extremity musculoskeletal disorders. It is most relevant for individuals with conditions affecting the hand, wrist, or arm, such as distal radius fractures, carpal tunnel syndrome, and rotator cuff injuries. The tool is frequently used in orthopedic and rehabilitation settings to assess physical function and symptoms. It facilitates monitoring of patient progress and treatment outcomes in both acute and chronic clinical contexts. Its brevity and focus on disability make it suitable for routine clinical use and research involving upper limb function. The Quick Disabilities of the Arm, Shoulder, and Hand questionnaire consists of 11 items assessing physical function and symptoms in patients with upper limb disorders. Each item addresses specific activities or symptoms, such as opening a jar, carrying a shopping bag, or tingling sensations. Respondents rate their difficulty or symptom severity on a 5-point Likert scale, ranging from no difficulty or symptom to unable to perform or severe symptoms. The clinician instructs the patient to consider their condition over the past week and to select the response that best describes their current status. Once completed, the raw score is calculated by summing the item scores and transforming the total to a score between 0 and 100, where 0 indicates no disability and 100 indicates the most severe disability. Interpretation involves comparing the score to established reference values, with healthy populations typically scoring below 10, while higher scores suggest increased disability. Scores exceeding 50 often reflect significant functional impairment requiring targeted intervention. The tool demonstrates excellent reliability and validity, making it suitable for both clinical assessment and outcome measurement in upper extremity musculoskeletal conditions. Sensitivity refers to the ability of a test to correctly identify patients with a condition, indicating the proportion of true positives. Specificity denotes the test's ability to correctly identify patients without the condition, reflecting the proportion of true negatives. The Quick Disabilities of the Arm, Shoulder, and Hand score has demonstrated varying sensitivity and specificity depending on the cutoff values and clinical context. For example, studies evaluating QuickDASH in patients with upper extremity disorders have reported sensitivity values ranging from 0.78 to 0.85, indicating that it correctly identifies 78 to 85% of patients with significant disability. Specificity values have ranged from 0.65 to 0.78, showing that QuickDASH correctly excludes 65 to 78% of patients without disability. In clinical practice, a high sensitivity of QuickDASH facilitates detection of individuals affected by upper limb dysfunction, minimizing missed diagnoses. Conversely, its moderate specificity suggests some false positives may occur, which may require further clinical assessment. The Quick Disabilities of the Arm, Shoulder, and Hand questionnaire was developed as a condensed version of the original Disabilities of the Arm, Shoulder, and Hand outcome measure, aimed at reducing respondent burden while maintaining psychometric robustness. Its validation process included extensive analyses of reliability, validity, and responsiveness across diverse patient populations with upper limb disorders. Initial studies conducted by the developers demonstrated strong internal consistency, with Cronbach's alpha coefficients typically exceeding 0.9, indicating high reliability. Test-retest reliability assessments reported intra-class correlation coefficients above 0.8, confirming stability over time. Construct validity was established through significant correlations with related functional measures and clinical assessments, supporting its capacity to accurately reflect upper limb disability and symptoms. Responsiveness was evidenced by the ability of the Quick Disabilities of the Arm, Shoulder, and Hand to detect clinically meaningful changes following therapeutic interventions. Subsequent research by multiple independent groups has corroborated these findings across various languages and cultural contexts, further endorsing its cross-cultural applicability. Historical data also indicate that the shortened format maintains comparable psychometric properties to the full instrument, thereby providing an efficient yet scientifically sound tool for both clinical and research settings focused on upper extremity conditions. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.